A new study on heart and health says there are ways to counter sitting's harmful effects. Now, according to findings published by the Mayo Clinic, 1 hour of exercise can actually offset the effects of sitting for 6 to 7 hours. But the study also showed that regardless of just how much someone exercised, sitting for prolonged periods still hurt their health. So, joining us to discuss this is Dr. Devi, NAMPIAPARAMPIL of NYU's Medical Center. Dr. Devi, thanks so much for being with us.
Nice to see you again, Morgan.
So why is sitting so bad? We're sitting.
Exactly. So it actually goes against an assumption that we had in the past, that we used to think that exercise, people who exercise were protected, and it really didn't matter how sedentary you were. Or if you sat a lot, that meant that you didn't exercise at all. Now we're realizing that these are two really separate things that we're looking at. So sitting a lot can actually affect a lot of different things in your body. It might be affecting the muscles. So if muscles aren't being used, it actually might change the way that you control your blood sugar. It might change the way that you control inflammation, all these different things that can set you up for heart disease or for diabetes and other medical problems.
So just to get that straight, there's a difference between sitting and simply not working out.
Exactly. So if you sit for a long time and still work out, you may still have problems. So the idea is that if you're exercising, you're protecting your heart, you're making your lungs stronger, you're doing a lot of different things that can be protective. But if you're sitting for a long time, even if you're still working out, you can still develop problems because you're having all these changes in the muscle in terms of different hormones. You might change the way that your cholesterol is being managed. So a lot of different things can be affected if your muscles aren't being used the way that they're supposed to be used.
But when you say exercise, exactly what do you mean? Exactly how much exercise are we talking here?
Yeah, so the recommendations vary, but most people say that you should do about 2.5 hours of moderate exercise per week and 1.25 hours of really intense exercise. So most people don't do that. Only about 50% of people can actually get that done, but that's still what we aim for. Now you can do that in 10-minute increments, so it doesn't have to be all at once, but the important thing is to actually reach that level of exercise. Now, the thing about this study that's nice is that they're actually looking to see, well, what makes a bigger difference and how do these things work with each other? Because, it may not be possible for people to just not be able to sit, just depending on their job.
A lot of us are trapped to our desks. We're having in front of our computers, we're sitting here talking to wonderful people like you. What can we do during the workday to kind of offset those negative effects?
Well, during the week, there are different things that you can do. In the office, you can try to stand while you're making phone calls or while you're having meetings. You can try to get up to use the wastebasket, the restroom, other things, just try to move around during the day or use the stairs instead of the elevator.
Got it.
But I think for this study, the key thing is really that they looked at this 1 hour and how it balances out 6 to 7 hours. Now, one of the problems in the study is they really looked at healthy people. So they didn't look at people who already had medical problems. So in healthy people who are already fit, who can actually participate in the study, it looked like it balanced itself out. But for people who have other problems, it might be a little bit harder.
So how reliable is this then? If it has those caveats, is it something that can be trusted?
It can be trusted, but we can't draw too many conclusions from it. So they're looking at a specific group of people, so it doesn't mean it applies to everyone. And they're also looking at what's called it's an observational study. So they're looking at people doing what they would normally do. So in a study, let's say if you're testing a new drug, you really want to give a group of patients the drug and see what happens as a result of it. In this case, they didn't make people exercise and they didn't make people sit down. They just let them do what they were doing normally and watch them. So you can't tell which came first. Is it that people who are sitting a lot they develop problems, or is it because they're developing problems that they sit a lot?
You're making me nervous. I feel like I need to get up and do a little stretch or something before you leave. All right, thanks so much, Dr. Devi.
Nice to see you again.
Nice to you as well. Thanks.